I'm here at my favorite physical therapy clinic, PT Renew in downtown San Francisco. If you're in California, you can also work virtually with Dr. Guy or any other fun folks. Fun side story, my husband works with Dr. Guy's wife, Dr. Lindsay, who's over there. I started working with Dr. Guy this year, maybe even beginning of last year, with a tendonitis injury, a foot injury. But I've been here, I've seen lots of doctors here, and they're all fantastic. But in working with Dr. Guy, we've been discussing a lot about tendonitis or tendinopathy, which he can explain the difference between the two way better than I can. But just for like some context, we're going to be talking a lot today about Achilles injuries specifically, but also trying to like broaden the conversation about like tendon injuries or other injuries amongst all of our joints, and sort of like the psychology of an injury, how to like think about it, what caused it, what to do about it, when to like sort of embrace a little bit of discomfort and pain around injuries, and when to like pull away from them. And the real reason that like the biggest like aha moment for me, and what I'd love to talk a lot about, is getting tendonitis in my Achilles. That was the first injury that I've ever had where I was like encouraged and pushed into some discomfort. Like as a trainer, like if a client comes to me, if one of my people comes to me, whether it's their foot or their knee or whatever, or their shoulder, and it's like, ow, this really hurts, my job is to back away and then send them to you. Generally, most generally. And this injury was the first one where I felt like, where you said, you know, a little bit of pain is okay. We need to, like once you get past like the really painful bit, like it's okay to feel a little bit of discomfort in some of the treatment that we do, like some of the exercises and stretches, as long as it goes away.
Definitely.
So I want to talk about that. So maybe we can start with like, and we can talk about the Achilles, but obviously like we have tendons all over the place. Like what is the difference between, like what is tendonitis? And then what is this new word tendinopathy that I hear more and more about?
Sure. So I think tendonitis was kind of like this older school mentality of we thought there was a lot of inflammation within the tendon. You know, we used to like really arrest these things and put ice and really try to like reduce this inflammatory process, even using like steroid injections or medication to do so. Now we think that a lot of that inflammation could be positive and could actually help that tendon repair and send the right mediators to stimulate healing. So we've kind of gotten away from this term of like itis, of being like an inflammatory process. There is inflammation that occurs, but we don't always think that happens in the longer term. So we're starting to get away from that term and use the term tendinopathy, which just means a disruption to that tendon that causes some level of discomfort.
And in your experience, and it's probably both, but like it begs the question,
Yeah.
like for me, I suspect, I don't know, like, you know, it's hard to have like a body, just having a human body these days is tough. And it might not be like one specific thing, but like in general, what causes, is there like I guess, or what are the main causes? Yeah.
Yeah, I mean, it could be a number of things, obviously, but the biggest thing is just doing a little too much too soon, you know, overloading that tendon. We have this like kind of balance between like breakdown and repair. And when that balance gets shifted and we have more breakdown than we do repair, then that's when we lead to these kind of tendon issues.
To like running 2 half marathons back to back every weekend for a few years.
That could do it.
Got it.
Yeah. Tends to be like these overuse type of injuries where we're really loading that Achilles heavily or loading that tendon heavily and just not allowing enough time to repair and then see that repair process fully through.
Got it.
So recovery between bouts of exercise is very important. You know, we don't really get stronger lifting weights in the gym or running. We really get stronger on the couch, relaxing and allowing that recovery to create that super compensation and see that increase in tendon strength and muscular strength as well.
So when it comes to like treatment then, again, we'll talk about the Achilles, but perhaps like we can talk about a couple of different joints. Like at what point do you rest? Like we've always heard, if you have tendonitis, you have to rest it, right? And that's kind of what I thought. And when I first started, like before I realized that it was full-blown tendonitis, I was like stretching and resting, and obviously it wasn't really doing anything. Like you would know that it's not doing anything. And then when I came to see you, we started doing, you know, you were pretty clear, like we need to get you doing some loading movements, right? We can talk about it, but like, can you like explain a little bit about that? Because that might not be intuitive. It wasn't intuitive for me. I was like, are you serious? Like it's okay to like be a little,
feel that pain.
Yeah, to feel a little bit of pain.
Yeah. So I think initially, right, we need to offload that a little bit, right? We want to allow some recovery to take place. So I think usually about 2 weeks is reasonable, especially if you're not having like pain with walking and those sorts of things that are affecting your day-to-day life. So we want a little bit of rest, a little bit of recovery, but then we do want to start loading it pretty quickly. We were loading it already, especially with Achilles, right? We're already loading it walking, going up and down stairs and those sorts of things. We don't think about that as truly hitting the Achilles very heavily, but we're adding some load gradually with normal activities as well. So it's good to start to increase that load. That load that we put through the tendon, when we get that pull in there, it helps get some of the water out of that tendon. It also helps pull at those fibers and start to create the stimulus for healing and the stimulus for repair. Tendons tend to warm up with load, so that's why it can be difficult too. Like you mentioned, like, oh, I go for a run, I actually feel better as I run, and it kind of goes away for a period of time. So like that warm up effect in the tendon is very common. So we have to make sure that we're adding a little bit of load, allowing for some warm up, allowing for some of that fluid to leave the tendon and get some of that inflammation to come down. So that's usually in like the 2 to 6, 8, 12 week period as we're starting to add load very gradually. So we're looking to like increase a bit of discomfort within that tendon. That gives us a little bit of that stimulus, and then we want it to recover rather quickly within like 30 minutes to an hour or so. So adding some load, adding some discomfort, and then allowing that to recover each bout is really the stimulus that helps that tendon repair.
And I think, I know I had this, like, not only just as a trainer, but my clients have kind of said similar things with injuries that they've had, from feet to back to hip to shoulder. I'm kind of going through the list of different humans, and if they're watching, they'll know which ones they are. So I won't name names. But I have one client, for instance, who has had a shoulder pain. Thought he just did a couple too many push-ups, was really into doing pushing, sort of like me and running, right? Like he thought, hey, I'm gonna do this several times a day for like a couple of weeks,
right.
And started to feel a pinch, and like after a couple of weeks, it didn't go away, got an MRI, and it was like, just a laundry list of all of these itises and apathies and tears and this and that and this and that and this and that. And it's very easy to go down to read these like MRI reports that are, very helpful. Like as his trainer, him as well, it's helpful to know. But there was a bit of like, am I falling apart? Like, am I like, can I not be trusted to walk down the street? Like, am I walking wrong? Am I like pressing wrong? Am I doing everything wrong? And so I guess I'm asking, in your experience, like what type of psychology or mindset can someone who gets injured, whether you're a trainer or physical therapists get injured.
You do,
right? Okay. We'll see you after you hike Whitney and see how you.
Yeah, fair.
So can you talk a little bit about like how you help people through that, or like what type of like what sort of like meditation you should do before you read an MRI report, and how that works with you guys?
Definitely. So MRI reports are great. They give us a lot of information about what's going on, and they probably give us like almost too much information about what's going on at times. I always joke they're kind of like the guy you return your rental car to. They're gonna find like every little ding, dent, anything.
Yeah.
They're really only judged on like what they miss,
Yeah.
not necessarily what they find. So I think oftentimes they're looking for any little tiny imperfection. So they use these big words that make it sound very scary and that we can't move and we shouldn't touch anything. But I think it's good to, start to reduce that fear and be like, all right, we're gonna find a ton of things in here on asymptomatic people as well.
Right.
So there's not a ton in there that might not be relevant to your case. So it's important to see somebody, either a surgeon or a healthcare provider that can look at that and be like, no, these are actually relevant in this case, versus those are just asymptomatic findings that probably would have been there regardless of your shoulder pain in general.
That's really interesting, because I said of the things, there was like a little arthritis, and there was some tendinopathy and some degeneration. There was a slight like tear, and I was like, I am really curious I wonder which of these things is causing the pain.
Right.
And I wonder if we ever would have found them out had, whatever triggered that pain, had not looked, right? I can speak, I had a really bad back injury in 2019, and that MRI report scared me to death. I thought I would like never move again, and within a few weeks I was like running and it was fine, and I even got a consult with a surgeon, and he was like, why would I cut you? And I said, well, because look at this MRI. He's like, you ran here, right? And I was like, yeah. He's like, you ran 5 miles today and you're in no pain.
Yeah.
I'm not going to cut you. I don't care what that says. And that was in 2019, and my Achilles so far is the only thing that has been an issue.
Yeah.
So I, like you said once, like any injury or any MRI, doesn't have to be a death sentence,
No,
which
not
I
at all.
appreciated. In fact, with mine, I tried many times to get out of running. I've been like, should I not run? And you never ever said no. So that's really, I find that like helpful. And I thought maybe we could do a quick, so I'm putting you on the spot, this is like an ad lib one, but are there things, like, okay, so once you have tendonitis or tendinopathy, and we'll go with Achilles because, you know, I do work with a lot of runners, I do work with people who have calf pain, like, obviously we'd rather prevent it than treat it.
Definitely.
And I definitely heard, like, listen to your body, you know, don't do like multiple long runs, or maybe don't do like, you know, tons of loading, you know, on simultaneous days, like ample rest. But are there any type of like drills or exercises or warm-ups for, let's go with like the ankle joint for feet or for calves, that are good for people who are worried that they might, as a preventative measure to tendonitis? So particularly people who like are on their feet a lot or run a lot.
Yeah. So I mean, I think the number one thing that all runners should be working on is some series of calf raises.
Okay.
Right? We have to be loading the calf and loading that Achilles tendon pretty effectively in order to stay injury free. I think it's always something good to look at. For our runners, we try to get them up to like being able to do 25 calf raises, single leg, without any discomfort. So it's like a good metric to try to be able to hit. So those are really good preventative exercises specifically for the Achilles. Yeah, definitely.
Can we make your mirror all dirty? My favorite
Definitely
thing.
can.
I know Nicole likes that.
So the biggest thing we're looking for with the calf raise is you want to go for a single leg first.
Sure.
So we'll go knee straight here,
Okay.
and then you're going to lift that other leg,
Okay.
and then you're just going to raise up on this leg as high up as you can.
Okay.
Now, if you can see in that video, notice.
I bent my knee.
Yeah, we bend our knee and we lean forward a bit.
Oh,
so
no.
we want to try to go straight up through the sky, going right off that Achilles there.
Right
Right there and straight up. Good deal.
And then slowly down.
And slowly coming down. So being able to do like 25 of these on each leg is a good metric for most runners. And it's pretty challenging.
It is very hard.
Yeah. And the height is very important as well, so we want to make sure you're getting all the way up there each time. You know, if we're testing this in the clinic, we're pretty strict about it, so if we start losing that height, we're just going to cut you off and say, oh, no, about 12, rather than getting to that 25 number.
That's so hard.
This really puts a lot of load to that tendon, through that muscle, and allows us to prevent injuries in those areas.
Beautiful.
So I think that's a good one to work into just like a daily strengthening routine, or anytime you're at the gym, just kind of working that into a routine like 3 days a week or something like that.
Nice. And then I have one other question, because you gave me this, and then I had clients whose PT in DC gave them this, and they gave, some of the walking ones. And it's funny, it's a couple, they know who they are, and they always have like reciprocal injuries, and they do different things. It's like maybe like sympathy pains or something. And so I always forget which one. One has to walk on their heels, and then one is told to walk on their toes.
Yeah.
Is that something that like?
Yeah.
I always like.
I think it's a great warm-up.
It's always interesting, like when I work with PTs or when I work with PTs via clients and like learn stuff, and then I always like to ask like, what can I as a trainer, or what can people watching as like general population should feel like cool to do on their own? And like I know, like for instance, like I once had a nerve, right? And a doctor I worked with here, a great doctor, gave me a nerve glide. I'm like, oh, this is cool. Can I like share this with people? And he was like, maybe, probably not. Like, because you don't. So I always want to make sure that things that I do as a trainer like support physical therapy or like support general pop. So like, what about heel walking and toe walking? Is that generally?
That's generally good advice.
Okay.
I use that as my warm-up. I'm a bit of a lazy runner when it comes to warming up.
Okay.
So I like to make it really quick and really easy. So that's a warm-up that I give to a lot of runners.
Okay.
We can go through it too if you'd like to.
Yeah, super quick.
So the circuit that I like to do is pick like a big patch of grass or like the sidewalk.
Okay.
And what we do is we walk forward on our heels first.
Okay.
Just trying to warm up. Yep. Warm up like the shins in the front.
Okay. So
we walk like 25, 30 feet. Then we come up on our toes, and we'll do backwards walking.
Oh, this
on
is the one I
toes.
always forget. Shoot, I thought I was going to be good at that.
Forward up the Achilles. Then we go toes out.
Okay.
Walking forward.
That one actually feels good. I forgot about walking.
Then we turn, we go pigeon toes walking in.
Okay.
And then we go walk walking on the outsides of our foot.
This one always feels good.
I think so too. So this next one is tough.
I like that it's the, I think we'll do the, yeah, this one's harder.
But it's just
I
actually all the muscles around the calf.
I find, yeah, and the plantar fascia. And then the one, I hate this one.
The side step.
I don't know why, I don't feel good with this one. It's like.
This one was more
And
specific
then-
for you because I don't always get this one out.
Oh, no, okay, well, just kidding. Well, you can
No,
try
this
this
is a good
at
one,
maybe.
I forgot about that one.
I do this one in a karate gym and I kind of feel like an idiot, but you know, whatever.
But a quick, like, actually take less than 5 minutes to go through, and it warms up everything in the calf. Add some couple squats, couple lunges, and you should be out the door ready to go.
Beautiful.
Wow.
Well, thank you so much. This is super helpful.
Absolutely.
Anybody, I mean, if anybody watching this is a client or a follower of mine, so I just wanted to come down and do something fun with Dr. Guy and the folks at PT Renew, and definitely give them a call if you need anything, if you've got any pain.
Awesome.
Thanks,
Thanks
guys.
for coming in.
Okay.